A spokesman for the Hamas-run health ministry in Gaza says an Israeli tank is now stationed outside the city's biggest hospital. The Al-Shifa hospital says it's not accepting any new patients after running out of fuel to power its generators. The Israeli military says it will allow what it calls a self-evacuation corridor from the facility on Monday, which would enable people to seek safety in southern Gaza. The World Health Organization says thousands of people are trapped inside.
Stitching up a head wound by the light of a mobile phone. Doctors in hospitals in northern Gaza are struggling to save patients. Here too, at the Al-Shifa hospital, they're running out of fuel, water and medical supplies, and are vulnerable to the ongoing Israeli airstrikes in the area.
Hospital under fires. The last example is Shifa Hospital ICU. There is another private obstetric hospital was targeted directly today, and two of our colleagues who are specialists in obstetric and gynecology were killed tonight. There is no service for pediatric patients in the northern area.
Israel denies targeting civilians and says that this footage is proof that its military provided the Al-Shifa hospital with 300 litres of fuel for its generators, but that it was rejected by Hamas.
We offered actually last night to give them enough fuel to operate the hospital, operate the incubators and so on, because we have obviously no battle with patients or with civilians at all. And I think every civilian death, every dead baby is a tragedy. But that tragedy should be placed squarely at the responsibility of Hamas, that is keeping its military installations inside hospitals, its command posts inside hospitals, inside schools, inside UNRWA, UN facilities and so on.
The director of Al-Shifa has denied rejecting the fuel, which he says would not have been enough to power the hospital's generators for even 1 hour. The worsening situation in northern Gaza is forcing thousands to flee southwards, mostly on foot. Even some health workers have made the decision to leave.
The situation last night was very tense, very extreme. The bombing targeted schools and hospitals. I work for the office of the Ministry of Health at the hospital. Yesterday, the Israeli army bombed the hospital where I work. That's why today I did not go to work or fulfill my duties, and I fled.
Tens of thousands have already fled the ongoing missile strikes and ground operation. Israel is coming under increasing international pressure to minimize civilian suffering in Gaza.
Well, Toby Fricker is from UNICEF and joins us from Amman in Jordan. Palestinian officials say power outages are threatening the lives of premature babies in particular. Some of them can't survive without incubators. What are you hearing?
Yeah, I mean, the reports from Al-Shifa in particular, but also other hospitals across northern Gaza Strip are disastrous when you see premature babies who rely on incubators, who rely on oxygen, they need power. It's really a catastrophic situation. And, we have a situation where half of the medical facilities, half the hospitals inside Gaza are now not functioning. And that's bad at any time in peacetime, yet alone when you have a crisis like this where you're also taking in massive numbers of injured people, injured children.
What about the claims from Israel's military, which says it's been helping evacuate some patients, mostly kids, from Al-Shifa hospital? Are you able to confirm that?
Well, I mean, evacuations of hospitals at any time are incredibly difficult and incredibly dangerous, particularly for very vulnerable patients like newborns and other children, other civilians who are on dialysis, for example. So evacuating hospitals is almost impossible to do that safely at a time when the hostilities are still so intense inside the Gaza Strip. So this is a huge concern. Just to be able to bring people out is so difficult. If it's a safe passage and if the doctors are able to manage that, then maybe there is a way. But right now, the situation is far too acute and dangerous for that to happen.
Well, Toby, what is the way? Because at the moment, things aren't going to change, according to Israel, until all hostages are released from the Gaza Strip. So what can be done to help these kids in Gaza?
Well, I mean, there's a simple way, and that is to have a ceasefire. You know, to have a humanitarian ceasefire which will stop children being killed, stop children being injured. And at the same time...
As I just said, that's not going to happen until Israel sees those hostages released.
I was just going to say, at the same time, is for the immediate release and unconditional and safe release of all the Israeli children, civilians and children especially, who have been abducted, which is a grave violation. And so those conditions are absolutely vital that both those are achieved for the sake of every child. But at the same time, then we also need to scale up massively this life-saving support to help children and civilians who are in the shelters, who are all over the Gaza Strip, displaced as well.
Because at the moment, we just keep going in circles, don't we? And this war has been going on for a month now. Yeah,
you're right. I mean, day in, day out, we're saying the same thing. And it's not getting any better. It's getting worse, if anything. And that's what's so tragic, is that we're not able to secure, any conditions that can improve the lives and better protect children. And that's up to the parties of the conflict. As UNICEF, as a humanitarian agency, we're here to advocate for the protection of children. We're here to support them and do whatever we can to provide life-saving assistance. But this is up to the parties to the conflict. This is up to others who can help to influence that. And we do our advocacy, and we'll keep doing that until children are better protected.
UNICEF's Toby Fricker there for us, joining us from Amman in Jordan. Thank you very much for the insights.